All right, let's go to the second part of the wrist and hand. So locations of the wrist and hand muscles, anteromedial at the elbow and forearm and the anterior of the hand, primarily does wrist flexion. You've got the Flexor Carpi Radialis, Flexor Carpi Ulnaris, and the Palmaris Longus. Remember, not everybody has a Palmaris Longus. Now, primarily wrist and phalangeal flexion, so those are your fingers. That's the FDS, Flexor Digitorum Superficialis, Flexor Digitorum Profundus, and the Flexor Pollicis Longus. Now, posterolateral, so on the back, at the elbow and forearm, and posterior at the hand, that primarily do wrist extension. You got Extensor Carpi Radialis Longus, Extensor Carpi Ulnaris. So you have to really study these in chunks. Like, okay, what are the muscles that do wrist extension? What are the muscles that do wrist flexion? Because those are the kind of questions that I'll ask. Say, oh, all of the following muscles do phalangeal extension except, right? So when you see a whole bunch of material on a slide, you're thinking, okay, well, what can he ask? How can he ask it? And it's usually a group of questions say which one doesn't belong. Okay, so wrist and phalangeal or finger extension, that's Extensor Digitorum, Extensor Indicis, Extensor Digiti Minimi, Extensor Pollicis Longus, Extensor Pollicis Brevis, and Abductor Pollicis Longus. All wrist and hand muscles are innervated from the radial, median, and ulnar nerves of the brachial plexus. So radial nerve from 6, 7, and 8 are Extensor Carpi Radialis Brevis, Extensor Carpi Radialis Longus. The PIN, or the posterior interosseous nerve, from the radial nerve, so that dives deep into the forearm, and that's Extensor Carpi Ulnaris, Extensor Digitorum, and Extensor Digiti Minimi. Then you have Adductor Pollicis Longus, Extensor Pollicis Longus, Pollicis Brevis, and Extensor Indicis. Pollicis means thumb, again. The median nerve, rising from C6, 7, 8, and T1, you got Flexor Carpi Radialis, Palmaris Longus, and Flexor Digitorum Superficialis. The AIN, which is the anterior interosseous nerve, from the median nerve. Flexor Digitorum Profundus for the index and long fingers. Flexor Pollicis Longus. Intrinsic muscles, Abductor Pollicis Brevis, Flexor Pollicis Brevis, superficial head, Opponens Pollicis, and first and second lumbrical. Ulnar nerve, branching from C8 and T1, supplies Flexor Digitorum Profundus for the fourth and fifth fingers and the Flexor Carpi Ulnaris. Most traumatized upper extremity nerve. So this is a great quiz question. Remember how I told you the ulnar nerve is the contusion, that's the funny bone with painful tingling sensation into the ulnar side of the forearm. So that's your ulnar nerve. So that's a good question. Most traumatized upper extremity nerve, that's the ulnar nerve. Chronic contusions or pressures may lead to nerve hypersensitivity. So throwing athletes may experience a traction injury with medial elbow stress during surgery, may become inflamed from subluxing or slipping out of its groove. Innervates the remaining intrinsic muscles, Flexor Pollicis Brevis, deep head, Adductor Pollicis, pulmonary side, dorsal inner side, third and fourth lumbricals. Provides sensation to the ulnar side of the hand, ulnar half of the ring finger, and the entire little finger. All right, so let's look at the Flexor Carpi Radialis muscle. So now you're saying, okay, what does each individual muscles do? And there's a ton of muscles in here, so just make sure you know the actions. Again, I'm not too interested in the origin insertion unless I put it specifically on a study guide. Flexion of the wrist, abduction of the wrist, weak flexion of the elbow, weak pronation of the forearm. Palmaris longus, flexion of the wrist, weak flexion of the elbow. Extensor Carpi Ulnaris, extension of the wrist, adduction of the wrist, weak extension of the elbow. So when you see weak, don't you can just ignore that. I want you to understand the majority of what it does. Okay. So Extensor Carpi Radialis Brevis does extension of the wrist, abduction of the wrist. Extensor Carpi Radialis Longus does extension of the wrist, abduction of the wrist. Okay, a little bit of elbow flexion, a little bit of pronation. Flexor Digitorum Superficialis, FDS, it does flexion of the fingers at the metacarpophalangeal and the PIP joints. Flexion of the wrist, weak flexion of the elbow because it's a two-joint muscle. Flexor digitorum profundus, flexion of four fingers at the MCP, PIP, and DIP. So flexor digitorum profundus will move your distal fingers as well, flex them. It also does flexion of the wrist, where FDS doesn't go into the DIP joints. Flexor pollicis longus, flexion of the thumb, CMC, MCP, and IP joints, flexion of the wrist, and abduction of the wrist. Extensor digitorum does extension of the second, third, fourth, and fifth phalanges, extension of the wrist. Extensor indices muscles, extension of the index finger at the metacarpal phalangeal joint, weak extensors, weak supinators. Extension of the little finger at the MCP joint, weak wrist extension, weak elbow extension. Extensor pollicis longus, extension of the thumb at CMC, MCP, and IP, extension of the wrist, abduction of the wrist. Extensor pollicis brevis, extension of the thumb at the CMC and MCP joints, weak extension of the wrist. So really, I mean, you just got to look at what do these actions do. Remember, this is a movement anatomy class. I'm more concerned about movement and what muscles are responsible for what movement. Abductor pollicis longus, abduction of the thumb at CMC joint, abduction of the wrist, extension of thumb at CMC joint, weak supination. These are all the intrinsic muscles of the hand. A lot of them. Lumbricals, adductor digiti minimi, flexor digiti minimi, you name it. Flexor pollicis brevis, abductor pollicis. So looking at that and seeing all those muscles. Now the thenar eminence, that's the muscular pad on the palmar surface of the first MCP. Abductor pollicis brevis, opponens pollicis, flexor pollicis brevis, and adductor pollicis. Remember, pollicis means thumb, so this is on the thumb side. Hypothenar, this is on your pinky side. So muscular pad that forms the ulnar border of the palmar surface. That's the abductor digiti minimi, flexor digiti minimi, opponens digiti minimi. So digiti minimi is the pinky. Intermediate muscles, you got 3 palmar interossei, 4 dorsal interossei, 4 lumbrical muscles. 4 muscles that act on the CMC of the thumb, opponens pollicis, opposition of the thumb, adductor pollicis brevis, and flexor pollicis brevis. Flexor pollicis brevis flexes the thumb, adductor pollicis adducts the thumb, and flexor pollicis brevis and adductor pollicis. Okay, so a lot of terminology here that you just have to slow down and just look at it. 3 palmar interossei adduct the second, fourth, and fifth phalanges. 4 dorsal interossei flex and abduct the index, middle, and ring, assist with extension of the middle and distal phalanges. 3rd dorsal interossei adducts the middle finger. The 4 lumbricals flex the middle, index, ring, and little proximal phalanges, extend the middle and distal phalanges of the index. 3 muscles act on the little finger. Opponens digiti minimi causes opposition of the little finger. Adductor digiti minimi abducts the little finger. Flexor digiti minimi brevis flexes the little finger. Now, so here's now putting it all together. What are the agonists for wrist flexion? So these are all the muscles that will flex your wrist. That's flexor carpi radialis, flexor carpi ulnaris, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. Now, what are the agonists for wrist extension? You got extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, extensor digitorum, extensor indices, extensor digiti minimi, extensor pollicis longus, and extensor pollicis brevis. So you're thinking, okay, how do I study all this? Well, you got to group them and say, and really looking at it, if you break it down, what does carpi radialis? So it extends your wrist on the radial side and it's long. Extends the wrist on the radial side, it's short. Right? So breaking down the words would be beneficial. What does wrist extension? Agonist. Okay, so these are just different muscles. Extensor, extensor, extensors. Wrist abduction, you got the flexor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis. Adductor pollicis brevis, extensor pollicis longus, and extensor pollicis brevis. So put them into groups, make flashcards, and say, okay, these are the ones that do wrist abduction. These are the ones that do wrist extension. These are the ones that do wrist flexion. Okay? Now, wrist adduction, you have flexor carpi ulnaris and extensor carpi ulnaris. So if you look at this, I could easily say which of the following does not do wrist abduction and throw in ulnaris because you know it's on the other side, right? So studying them in groups would be beneficial instead of just making flashcards. Understand where they are in the body, palpate them on yourselves, and see where they are. Phalangeal Flexion, that's the Flexor Digitorum Superficialis, Flexor Digitorum Profundus, Flexor Pollicis Longus. Phalangeal Extensor, Extensor Digitorum, Extensor Indicis, Extensor Digiti Minimi, Extensor Pollicis Longus, Extensor Pollicis Brevis. Phalangeal Extensor, again, Digitorum Indicis, Digiti Minimi, Pollicis Longus, and Brevis. And there you go, right? So you're thinking, whoa, wow, that was too fast. But really, I mean, just going over these over and over again would be the most beneficial. Again, I'm more concerned about the muscle movements versus the origin insertion. But if I will do one origin insertion, I'll put it on the study guide. All right?